Okay. Bismillahirrahmanirrahim. Assalamu alaikum. I'm Dr. Seema Aftab from Department of Pediatrics, the IMC. And before starting the presentation, I would like to welcome you all after a very long break. The things were going pretty much normal online before the COVID hit again, and now Alhamdulillah we are back now. Acha ji, today we don't have the camera, so we'll have to do things without it. So for this lecture, the camera is not required as it is. So in continuation of your infectious module, today we will be dealing the infectious side in pediatrics. Okay, today's topic of our lecture is assessment and identification of a sick child and management, and then diarrhea and diarrheal diseases and deworming. It's a very lengthy topic. Mainly the assessment of sick child in pediatric age group is we use a system that is known as IMNCI to assess the child and to look for the severity of the condition. So as we say, so we would be following the IMNCI charts, and in the meanwhile we would be discussing how to assess the child and how to assess diarrhea. IMNCI is a very lengthy chart. You may not have heard it before, but I'm pretty much sure that after a while you would be listening about IMNCI whenever you people will be coming to pediatrics, whether that be the pediatric ward, whether that be the pediatric class. So IMNCI is the integral part of pediatric management and planning. So ये तो दिख रहा है. What does IMNCI means? IMNCI stands for Integrated Management of Neonatal and Childhood Illness. So this is the basic charts, basic algorithm pattern that we follow on, that we apply on every child who's coming to us in OPDs or in the emergencies. This management plan is not mainly for the tertiary care centers, but also for those basic health units, and especially at the rural health centers. So what is the main role, what is the main function of this IMNCI? What does this IMNCI tells us? So the goals of IMNCI is standardized case management of sick newborns and children. Like they have standardized the care, whether the child is coming to an emergency care of some interiors of the sin or is coming to a metropolitan city like Karachi. So we have certain guidelines that we apply on all the patients, and it is so that a standardized treatment can be given to all patients. Now, it focuses on the most common causes of mortality. Can anyone of you tell me what are the common causes of mortality in pediatric age group? पता तो चले कौन कौन जाग रहा है. I can see so many students on 150 participants, and I guess it's both from DMC and DIMC. Yeah, some people have started answering. Means उठे हुए हैं सब. So diarrhea, pneumonia, meningitis, diarrhea, malaria. What else? What are the common causes of mortality? Food poisoning. Means diarrhea, na? Sepsis, dehydration, or acute respiratory infections. What do you mean by acute respiratory infection? Accidental deaths nahi hote bachchon mein itne na. It can be one of the common cause in adult males, but asthma does not really contribute to mortality, but it does contribute a lot to morbidity. Meningitis or congenital heart disease, encephalitis, aspiration. Chalo, at least you people have the idea. Na? If I ask you what is the number one cause of mortality under 5, what would be your answer? Just one answer. The most common cause of pediatric mortality. Anyone from the huge list of 155 students? Pneumonia, ईमन ने कहा निमोनिया एंड डायरिया, सिड्स तो बच्चे उसमें आ जाएगा, न्यू बॉर्न में आ जाएगा, बट अंडर 5 मोर्टेलिटी, अंडर द एज ऑफ 5 years. नेफ्राइटिक तो नहीं हो सकता है, मलेरिया. So the battle is always there between pneumonia and diarrhea. Okay? It changes, it keeps on changes. The diarrhea and pneumonia are the two most common causes of mortality in pediatric age group, and even in this 21st century, we are losing our childs due to diarrhea, simple dehydration. So this is your third year. If you learn to treat and manage diarrhea and dehydration from the very beginning, so you will not regret ever losing a child due to dehydration. So it keeps on changing. During summers, the most common cause of mortality becomes diarrhea, and during winters and springs, it's pneumonia. And due to the availability of and inclusion of all the vaccines in EPI schedule, the pneumonia is gradually lowering, but due to bad hygiene and environmental conditions, diarrhea remains the most common cause. So, दूसरा गोल क्या होता है IMNCI का? Nutritional assessment and counseling for all the sick infants and children. So, IMNCI does not only identify and help in the treatment, but it also assesses the nutritional status and counseling of the mother, which is pretty much needed for those who don't have access to good health care. So they can be assessed and treated and counseled at the basic health unit, not necessarily by the doctors, but can also by the paramedic staffs. And IMNCI also provides home care for newborns. It promotes exclusive breastfeeding. It prevents helps in the management and prevention of hypothermia, improve illness recognition, and timely care seeking in the patient. So the essential components of IMNCI: it improves health and nutrition of workers' skills. It helps in the improvement of the health system. It improves family and community practices. Somebody asked, home care is along the lines of kangaroo mother care, right? Kangaroo mother care, we are not only talking about the neonatal management, we are talking about under 5. So yes, kangaroo mother care is one of the care of home management, but there are some other home management as well. Okay, as we will go, there will be so many lectures. I'm telling you, this is not the only lecture of IMNCI. Today's lecture will only cover a portion of IMNCI. So IMNCI is a very lengthy thing, and you will likely be having 2 or 3 more lectures on IMNCI. So as we go on, you will be your concepts would be very clear of the home management. So what the good practices of IMNCI can help is it accelerating the reduction in infant and child mortality. By just following the simple measures of IMNCI, we can reduce the mortality in both rural and the urban areas, particularly by its impact on neonatal mortality through home and facility-based care. Dusra, what is the advantage of the IMNCI? It lowers the burden on tertiary care hospitals, particularly in urban areas where access to care is not a limiting factor. Because urban mein, there are so many centers available. Like if every GP, every basic health care center follows the IMNCI, so there will be so many patients who will not be unnecessarily referred to tertiary care hospital like the civil hospital, Jena hospital, and our Dow hospital. And so many of the cases can be treated at basic health facility only by following the IMNCI guidelines. Chalo. Achha, this is a chart showing the burden of morbidity and mortality. You can see in this 54% of the population suffers from, the 54% contribute to the malnutrition. Okay, and then there is diarrhea and ARI. They are almost they are the rivals of each other. How do we follow the IMNCI? It's a color-coded management strategy. We classify the illnesses into the 3, like the traffic signals. Taken a pink classification, that means child needs immediate care and preferably the inpatient care. Then there is a yellow classification in which the child needs specific treatment. Usually that can be provided at home, like some of the antibiotics, some antimalarials, and oral rehydration therapy, and so on, depending upon the case. But the yellow classification means that the problem is there and it can be treated usually at home. Now, there is another, the green classification. That means the child usually needs no medicine or minimum of the medicines, and good home care is advised in those conditions. So it is a color coded chart. Just we ask few questions, we classify, and then treat. The classification, there can be three possibilities: pink or red, yellow, and green. अच्छा अच्छा जी, मेन चाइल्ड हेल्थ प्रॉब्लम्स कवर्ड बाय द IMNCI गाइडलाइंस. कौन कौन से प्रॉब्लम्स IMNCI कवर करता है सारे हम आज नहीं करेंगे. विल जस्ट हैव एन ओवरव्यू एंड विल डिस्कस डायरिया एंड द रेस्ट विल बी कवर्ड इन अपकमिंग लेक्चर्स. As we said, हमने शुरू में डिस्कस किया कि pneumonia and diarrhea are the two most common causes of deaths and morbidity and mortality. तो cough or difficulty breathing, then diarrhea, then there are certain throat problems, sore throat problems, then ear problems, fever and measles, malnutrition and anemia, and feeding problems, especially for the young babies or the malnourished babies. So about 3/4 of the presenting complaints, these all the complaints comprises approximately like more than 70% of the patients come with one or more of these problems to the primary healthcare facilities. So they all are covered in IMNCI, and if followed properly can be treated at the basic health facility at which the patients are coming. Be that अगर हम अपने अर्बन केयर की बात करें तो द प्राइमरी हेल्थ केयर फैसिलिटी क्या हो सकती है? द GPs. ठीक है ना? Almost every locality has 2 or 3 GPs available immediately. ठीक है? Smaller setups. और अगर हम अपने रूरल एरियाज की बात करें तो these primary healthcare facilities are the basic health units जहाँ पे like with sort of dispensaries. So IMNCI covers almost 3/4 of the complaint, like 70% of the complaints of the patients coming to those areas. And then only how will it help? GP is a general practitioner, a person who has completed the basic MBBS and has not opted for specialization, rather has gone for general practice. Okay. अच्छा जी. For many sick children, a single diagnosis may not be apparent or appropriate. Like with one complaint, there can be more than one diagnosis. Okay? Like if the patient is presenting with cough and fast breathing, so we can think of pneumonia in that condition, we can think of anemia in that condition, or we can think of, in very severe cases, Plasmodium falciparum, malaria in those cases. Likewise, if the patient is coming to us with lethargy or unconsciousness, we can think of meningitis, we can think of severe dehydration, we can think of very severe pneumonia, we can think of cerebral malaria. So with one complaint, we cannot only pinpoint to one diagnosis, we have to think of more than one diagnosis. And it's only later on, when we do the investigations, we can reach to the one final diagnosis. So if the patient is coming, again, the rash can be there due to some ear infection, some pneumonia, some septic illness, or if a child is very sick, infant, if a newborn, like this, the newborn classification hoti hai, usme very sick young infant hota hai, and then again that patient can have pneumonia, sepsis, meningitis, and so on. So basically IMNCI is divided into two parts. One is child age 2 months up to 5. There are separate charts for those because the presenting complaint and the diseases are different. One part of the chart comprises of treats and manages the patient from 2 months up to 5 years, and the other part of the chart is for young infants from birth to 2 months. So the symptomatology, the treatment, the classification, everything is different. So basically there are two main components. Today we will be focusing more on the first portion, that is the 2 months up to 5 years. How to move on the chart. ठीक है, there is a, अभी मैं chart दिखाऊंगी भी आप लोगों को. So all the boxes start with check. ठीक है, it applies to all the children. Wherever the check is written, you must enter the box. And there are certain boxes that start with asking the mother, in which you will ask the mother a few questions that has been told in those charts. If the mother says that the symptom is present, you will enter the box and assess the child further. And if mother says no, like if like there is a question in a IMNCI chart in which you ask whether the child has throat problem, so you'll ask the mother, okay, does the child have throat problem? If she says yes, you'll enter the box and classify the throat problem. If the mother says no, you will skip the whole box and move on to the next. ठीक है, next. Again, they are action oriented, color coded. Severe pink classification means a severe condition that requires urgent care and urgent referral to the hospital. Okay. Moderate condition means yellow, that requires treatment, and a mild condition that usually needs home care. So this is how the chart looks. ठीक है, अब हम आ जाते हैं अपना जो today's topic of our class is assessment and classification of a sick child and management. So, no matter with which complaint the child is coming to us, we have to start assessing the child by excluding and asking for the general danger signs. So this is, we have to check every child. देखो इसमें लिखा है ना, check for the general danger signs. अभी हमने जैसे किया था कि if the box starts with the check, that means we have to look at in all children. So whether the child is coming from respiratory illness, whether the child is coming from diarrheal illness, fever के साथ आ रहा है, meningitis के साथ आ रहा है, meningitis खैर obviously the child cannot tell, fits के साथ आ रहा है, or any complaint. If the child has come to you to your healthcare facility, you have to check for the general danger signs. ठीक है, उससे पहले आप क्या करेंगे, determine if this is an initial or follow-up visit for this problem. अगर follow-up visit है तो there are other instructions जिसमें treat the child आप करते हैं. You have already sent the patient home with some medication and have called the patient back after few days, 1 or 2 days. So the initial visit है तो you will check for the general danger signs. Now when we say the general danger signs, and remember we are following the chart of 2 months up to 5 years. The general danger signs are different for under 2 months, sorry, and we are not doing that part of the chart. अभी हम कर रहे हैं 2 months up to 5 years. So we have to check for the general danger signs in all the children. This is very important. And for those who are of the IMC student, when you will come back, whenever you will come back to the wards, we will not be teaching you this again. So do it very carefully. So there are 5 in total. If we talk about the general danger signs, so there are 5 in total. We have to ask the mother about 3 conditions, and we have to look for the 2 things. Okay, so there are 5 in total. We have to ask for 3 and we have to look for 2. Ask for 3 क्या है? Is the child able to drink or breastfeed? The number 1 is the child able to drink or breastfeed? If the child is smaller enough, under 6 months hai, so obviously we presume that the child is on exclusive breastfeeding. So we ask about whether the child is able to breastfeed or not. और यही बच्चा जो हमारे पास आया है, if this child is older than 1 year, 2 year, 3 year, 4 year, obviously वो breastfeeding तो नहीं होगा ना, तो we will ask is the child able to drink or not. ठीक है. Second question for the general danger sign is, does the child vomit everything? Okay, vomiting only 1 or 2 vomits in a day is not considered as a general danger sign. but vomiting everything is considered as the general danger sign. अभी हम discuss करते हैं क्यों. What is the difference between vomit and vomit everything? Third one is, we'll ask, has the child had convulsions? And what are the convulsions? Seizures, fits. कब हुए हैं? During the current illness. ठीक है? Now these are the three signs that you ask for it, and now there are two signs that we look for. We look for whether the child is lethargic or unconscious. ठीक है? And again the convulsions are here again. अभी हमने ask में पूछा था, has the child had convulsions, and we are looking for the convulsions as well. So we see if the child is convulsing now, and this is the most dangerous sign. अगर child convulse कर रहा है अभी, तो we'll defer every other thing. We'll defer every other thing and we'll treat the convulsions. Somebody asked how the mother will know that the child has had the convulsion. The mother will know, obviously. If every layman knows कि sometimes there is a possibility, अगर subtle fits हैं, तो they may not know about the convulsions, but usually this is the presenting complaint that they bring the child to healthcare facility, that the child is having fits, the child is having seizures, or they say that the child is having, वो आपको clue दे सकते हैं, the child is having abnormal movements. ठीक है? The child is having generalized tonic-clonic convulsions, and soon after the convulsion the child goes into unconsciousness. So yes, in many conditions the parents may know that the child has had the convulsions. There are few conditions जिसमें subtle fits होते हैं, उसमें they may miss, but उसमें भी they notice something abnormal. They may come to you and they may tell you that the child is behaving abnormally, and when you see then, or you ask, then you obviously can know that the child is having seizures. अच्छा, अब सारी चीजों को अलग अलग से कर लेते हैं. तो is the child unable to drink or breastfeed? If the child is not able to suck or swallow when offered a drink or a breast milk, that means the baby is unable to drink or breastfeed. Or if the mother says the child is not able to drink, or if you are not sure about the mother's answer, so what we can do, we can ask the mother to offer a drink to the baby. Clean it should be clean water if older enough, or mother, you can actually ask the mother to breastfeed in front of you so that you can assess whether the child is able to drink or breastfeed. Okay, this is how we assess. या तो mother खुद आके बताएगी, and if you have any doubt, or if the mother has any doubt, so you can actually document it in your office. Does the child vomit everything? Now this is important. Okay, the vomiting can be present in pediatric age group with so many of the illnesses, but there is a difference between vomiting and vomiting everything. One or two vomits can be considered as normal part of the illness. उसको आप general danger signs नहीं consider करोगे. Why? Because in that case, every child will be unnecessarily referred to the tertiary care hospital. But if the child is not able to take anything down the throat, is not tolerating anything, then there are high chances that the child will not have the medication as well, or later on the child may suffer from hypoglycemia or hypothermia or dehydration, because the child is vomiting everything. Anything that the mother is giving the baby, any food, any breast milk, any fluids or oral drugs, the child is throwing up all the things. So ultimately the child's electrolytes will get compromised, the child's sugar will get compromised. So this is considered a general danger sign. So see, this is the difference between 1 or 2 vomits per day or vomiting everything. Again, in this condition, if you are not sure, you think that the mother is exaggerating, or the mother is saying this due to anxiety, you can offer the child something to drink and see if the child vomits or not. As a third question, has the child had convulsions? In that depends upon how do you ask the mother. Okay, you should use the words that the mother can understand to determine whether the child has had convulsions during the current illness. What does mean this current illness means? Like, if, let me give you a scenario. If a child of 4 years old is brought to your to you with the complaints of, let's say, cough for 2 days, and you assessed the child. Okay, the child is having cough for 2 days. You are asking for the general danger signs, and in that you asked, has the child had convulsions? The mother said yes. When this 4-year-old child was born, he had an episode of seizure at birth. So, is this a general danger sign? This baby has had the seizures at birth. Any Have you got my question? Is this convulsion of a 4-year-old child who has come to you for cough for 2 days, and you ask when the mother, has the child had convulsions? She said yes, the child has had seizures at birth, at second day of birth. So the answer is no. ठीक है, क्यों no? Because has the child had it's not in the current disease. ठीक है, this episode of seizure is has occurred in the past, or there is a possibility कि कोई known case of epilepsy हो, उसको breakthrough seizures होते रहते हों, but अभी current illness में उसको ऐसा कुछ नहीं है, तो that will not be considered as the general danger signs. अब now the duration of that current illness, it varies. For some children, the duration of the current illness can be just 1 day. For some children, it can be 5 days. Like for a patient of meningitis, the illness usually starts as fever, high grade fever, just like any other viral or bacterial illness, and only later on, after a period of 2 to 3 days, when the brain meninges are involved so much, then the patient has seizures. So yes, if the patient is having complaint of fever for the past 2 days and seizures just before coming to the healthcare facility, in that condition, the conversion would be considered significant. Now, the third one, lethargic or unconscious. Lethargic child is a child who is not alert when he or she should be. Okay? The patient is drowsy and does not show interest in what is happening around him. So when the patient should be alert, like if the child is sleeping, so obviously at that time the child will not be alert, but an awake child should be alert and should be taking interest in the surroundings. And there is very slight difference between a lethargic child and an unconscious child. A lethargic child, although not taking interest in the surroundings, but can be aroused very easily. Can be aroused not easily, but can be aroused by giving the stimulus. And an unconscious child cannot be awakened. उसकी pulse होती है, respiration होती है, but that the unconscious child cannot be awakened by given the stimulus. Acha, somebody is repeatedly asking a question. I said we have to ask the mother, and later on I said, if any doubt, so we'll perform it. So ask the mother is one thing. Obviously, if the child is having a symptom or not, like cough अगर उसको है, या any throat pain or ear pain बच्चे को है, तो only the mother is the person who would be knowing, or the child himself or herself would be knowing के the child is suffering from cough or sore throat, and whatever the complaint is that. So for that you have to obviously rely on the mother, but in order to check the signs, like mother can't tell you that the child is having lethargic, ठीक है, or mother can't tell you about few things that the child, whether the child is lethargic or unconscious. It's your job, the healthcare provider job, to assess. Again, when you'll come to your clinical practice, you will be able to know the child is a thing about which the mothers are very caring. Okay, they do not they get anxious very easily. ठीक है, even with one episode of vomit for a smaller child, the mother get anxious and she may come to you and complain to you that the child is vomiting everything. But when you examine the child, you see that the child is all right. Then in order to clear the confusion and in order to prevent unnecessary referral to the tertiary healthcare, what you do, you document it in front of you. Next, lethargic and unconscious हो गया. Next one is we are running short of time. अभी हमें डायरिया भी करना इसी में इतना टाइम लग जाता है. Is the child convulsing now? The same thing, you just observe the child and see whether the child is having seizures now or not. And this is the condition where there is a possibility. किसी ने पूछा था कि how would the parents know? So there can be a possibility that you are sitting in the OPD having a long queue of patients and your assistant brings the patient to you. Okay, doctor, this child is seizing. So kindly see this patient despite being very far away from in the queue. So yes, there is a condition. Or kabhi kabhi ye hota hai ki when you are sitting in the emergency and a parent brings in the patient running to the emergency counter that the child is seizing. So if the child is convulsing now, obviously this is the severe condition and you have to treat. So ठीक है, signs हमने देख लिए. Any general danger signs? As we discussed in the beginning, this is one of the severest classification. So any general danger signs जो कि अभी हमने किए हैं present. So how would we? This is how we follow the IMNCI. We look for the signs. First, we ask few things. We look for the signs. We classify the illness, and then we treat the illness. So if any general danger signs, either 1, 2, 3, 4, 5, all of them can be present, or even if only one of them is present, we classify no matter what other symptoms are there. Any general danger signs if present, we classify as very severe disease. Okay, this is actually the classification of IMNCI. This is a very broad classification. It can be very severe disease due to meningitis. It can be very severe disease due to diarrheal illness. It can be very severe disease due to severe pneumonia. But we classify it, and remember, we are sitting at the basic health unit where there are not much facilities are there. So what we do, that we immediately treat. If the convulsions are there, we treat the convulsions. After treating the convulsions, we complete the assessment quickly. If appropriate, we give first dose of antibiotic. Treat the child to prevent low blood sugar. Now, this can be achieved. Agar unconscious child hai and you are able to pass IV, you will give the IV fluid. If the child is unconscious and you are not able to pass the IV, you will give through NG tube. And if the child is conscious, you will, and tertiary healthcare center is far away, like the patient has been referred to Karachi from, let's say, Tharparkar or some other far-flung areas. So we'll treat the child to prevent a low blood sugar. उस सूरत में आप ask the mother to give continuous blood breastfeeding to a breastfeeding baby or sugar water syrup. And then we refer urgently to the hospital. This patient cannot be treated as a basic healthcare facility. But before referring, we do some necessary measures that can be life-saving. Clear है सबको? So ये हम कर चुके हैं. Whenever present, general anesthesia should be considered in making a decision on the management of any other condition. Acha, next one is we ideally IMNCI में after assessing for the general danger signs, we assess the cough, but that will be covered in your pneumonia module ना, respiratory illness के respiratory module में cover होगा pneumonia. So अभी infectious disease में we'll cover diarrhea. So we are skipping the whole that box of pneumonia. ठीक है? And we ask the mother, does the child have diarrhea? ठीक है? अच्छा, what is the diarrhea? The diarrhea stool contains more water than the normal and are more frequent. But frequent passing of the normal stools is not considered as diarrhea. ठीक है. There is a possibility that the child may pass. Previously the child used to pass one stool per day or one stool per 2 day, but now the child is passing normal stools twice a day. So that is not considered as diarrhea. And it's pretty normal for exclusively breastfed infants to have soft stools because they are exclusively breastfed, and the breast milk contains approximately 87 to 88% of the water. So obviously उनके stool soft ही होंगे until unless they start having the soft diet. And usually here we have to rely on the mother ना. ठीक है. Again a confusing thing कि अगर मदर कह रही है कि my child used to pass one stool every third day and now the child is having 4 stools per day which is watery, so usually the mother knows that the baby has diarrhea. ठीक है. तो you'll ask the mother, does the child have diarrhea? And if the mother says yes, then you'll enter that box and will ask few questions to the mother. तो पहले आप diarrhea को assess करेंगे. What are general danger signs? ये कौन है? Who is this person? सारी तो वही वाली कहानी हो गई बच्चे के. We are almost in the middle of the lecture and have what should I say? I've wasted almost 40 minutes speaking, and you are asking what are the general danger signs. I'll go back to the presentation. You can know. So first we assess diarrhea. We ask the mother, does the child have diarrhea? She said yes. Okay. Then we'll ask, look and feel. अच्छा, ये देखो ये जो चार्ट है ना, this is how the IMNCI chart looks like. तो आप ये पूछेंगे इसी को ही बड़ा करके इन्होंने बनाया हुआ है. ठीक है. There is a portion of the chart where you'll ask the mother, and when you look and feel, ask, you have to rely on whatever the mother says. Look and feel is your own assessment of the child. As में क्या डायरिया है, for how long. ठीक है. And we'll note the duration. 1 दिन है, 2 दिन है, 14 दिन है, कितने दिन है. Other question that you'll ask is there blood in stool? If yes, तो अभी नीचे चार्ट आएगा. ठीक है. These 2 questions, they have their own importance in further classification. Now we'll look and feel. We'll look at the child's general condition. General condition में हम क्या देखेंगे कि whether the child is lethargic or unconscious or restless या irritable है या फिर normal है, not for the age. ठीक है. 2 साल के बच्चे की normal क्या होगा कि वो आराम से अपनी मदर के लैप में बैठा हुआ है, और if the child has brought with him or her a toy, happily playing with that toy. ठीक है. This is the normal condition for a 2-year-old. 10 साल के बच्चे की जनरल कंडीशन नॉर्मल क्या होगी? The child is walking into the OPD without anyone's assistance. ठीक है. And answers your questions. Then पहले आपने देख लिया जनरल कंडीशन असेस करी. Then we offer the child a fluid. ठीक है. And we'll see if the child is not able to drink or drinking poorly, or if the child is drinking eagerly. That means thirsty. अब drinking eagerly कैसे demonstrate हो सकता है? Like we all know the feeling of drinking eagerly at the time of the way we drink water at the time of iftar. ठीक है. That is drinking eagerly. Or the way we drink after having a long walk from our wards back to the college lecture hall. ठीक है. That is the feeling of drinking eagerly. When you are feeling thirsty, you drink quickly. Or the third condition क्या होती है? You offer the fluid and the child is drinking normally. Third one is we pinch the skin of the abdomen and we see does it goes back slowly, does it goes back very slowly, or it goes back normally. And एक और चीज इसमें यहाँ पे मिसिंग है. हाँ, I missed it here. We'll look for the sunken eyes. In that, we'll have to trust the mother. Some people have naturally sunken eyes. In that, you can ask the mother, if you have not seen the baby previously and this baby is new to you, you can ask the mother कि इसकी eyes ऐसे ही deep seated है या अभी अंदर चली गई है. तो mother will say नहीं, it has gone inside, it has gotten sunken during the recent illness. कि scalp तक तो बिल्कुल सही था, बट क्योंकि सुबह से उसने द चाइल्ड हैज पास्ट 8 लूज stools large, तो द चाइल्ड्स आईज हैज गॉन इन. ठीक है, तो कितनी चीजें हमने पूछ ली. जनरल कंडीशन, sunken eyes, whether the child is able to drink or not, and we check for the skin pinch. And the other question that we asked, diarrhea which lasted for 14 days or more is the persistent diarrhea. And we also ask, is there blood in stool? So the a child who has diarrhea with blood in stool during the current episode of illness, उसको हम classify करते हैं dysentery. अच्छा, जनरल कंडीशन वी हैव डिस्कस्ड इट. देखिए कि क्या हो सकती है, क्या पॉसिबिलिटी हो सकती है. नॉर्मल होगा, रेस्टलेस और इरिटेबल होगा, या लेथर्जिक और अनकॉन्शियस होगा. रेस्टलेस और इरिटेबल चाइल्ड कौन सा होता है? लेथर्जिक अनकॉन्शियसनेस वी हैव डिस्कस्ड प्रीवियसली कि वेयर अगर वो लेथर्जिक है तो द चाइल्ड कैन बी अराउज्ड विद डिफिकल्टी, but generally the child will be withdrawn from the environment and will not taking the interest in the environment. Unconscious baby क्या होता है? Who cannot be aroused by giving the stimulus. अच्छा, irritable और restless baby क्या होता है? If an infant or child is calm when breastfeeding, but again restless and irritable when he or she stops breastfeeding. The child is and cannot be, a restless baby cannot be consoled easily. ठीक है, जनरल कंडीशन है. देन लुक फॉर द sunken eyes. See, ठीक है, इसकी आईज एवरीबडी ऑफ अस कैन अप्रिशिएट कि दिस इज द sunken eyes. So the same thing, if you are in doubt, ask a mother. Her opinion helps you confirm that the child are sunken. अच्छा, ये हमने ऑलरेडी कर लिया है कि नॉट एबल टू ड्रिंकिंग. अच्छा हाँ, ऑफर द चाइल्ड फ्लूइड एंड वी सी कि इफ द चाइल्ड इज नॉट एबल टू ड्रिंक. अब ये कौन सी कैटेगरी हो सकती है कि इन विच द चाइल्ड इज नॉट एबल टू ड्रिंक डिस्पाइट बीइंग डिहाइड्रेटेड? एनीवन? This is a condition when the fluid loss is so much that the child is almost reaching to lethargy and unconsciousness. तो अगर अगर बच्चा डिहाइड्रेशन से अनकॉन्शियस हो गया है या लेथर्जिक हो गया है, तो despite the presence of dehydration the baby will not be able to drink at all. ठीक है, ड्रिंकिंग पुअरली भी यही होगा कि वो इतनी वीकनेस हो गई है, इतनी हाई गैस्ट्राइटिस नहीं होता. अब देखो IMNCI जो है ना, इस वी आर जस्ट डीलिंग विद द बेसिक्स. अभी तक आपने देखा सारी क्लासिफिकेशन में वी हैव जस्ट यूज्ड सिंपल क्वेश्चंस एंड सिंपल एग्जामिनेशन. कोई हाई फाई एग्जामिनेशन नहीं है. दिस इज द ब्यूटी ऑफ IMNCI है ना, कि यू आर पिकिंग द वेरी सीरियस कंडीशंस on the basis of simple measures, no in high-fi investigations. Even we haven't used this step up till now. ठीक है, हमने सिक बच्चे को आइडेंटिफाई कर लिया. नहीं बेटा, जो बच्चा जो इरिटेबल बच्चा होगा दैट विल ड्रिंक वाटर ना. ठीक है, जो अनकॉन्शियस और लेथर्जिक बच्चा होगा दैट विल नॉट बी एबल टू ड्रिंक और ड्रिंकिंग पुअरली. तो द चाइल्ड इज ड्रिंकिंग पुअरली, द चाइल्ड इज सो मच वीक एंड कैन नॉट ड्रिंक विदाउट हेल्प. इतना लेथर्जिक हो गया, इतना इलेक्ट्रोलाइट लॉस हो गया है बॉडी से, दैट द चाइल्ड इज नॉट एबल टू ड्रिंक एट ऑल. Only sometimes the child may only be able to swallow if the fluid is put in the mouth. तो उस कंडीशन में आप कहेंगे कि not able to drink है और drinking poorly है. Eagerly or thirsty, a child has the sign drinking eagerly, thirsty if it's clear that the child wants to drink. ठीक है, and sometimes the child may actually reach out for the cup and spoon when you offer him water. ठीक है, and when you take it away the child is unhappy. ये सारी छोटे बच्चे के लिए है ना, smaller infants, 1 year or 2 years child. Then comes the skin pinch. How do you do it? We do it on the abdominal skin. ठीक है, vertically skin को we grab a whole muscular mass around the abdomen between our thumb and the index finger, halfway between them like us on the side of the abdomen. Firmly picked up longitudinal fold of all layers of the skin. सिर्फ ऊपर की स्किन नहीं लेनी होती. This, do not use your fingertip. ठीक है, because this will cause pain. This is the correct method of checking the abdominal pinch. It's a clinical method. Don't worry about it. You will be taught once the conditions get better and you come to our you come to the awards. ठीक है? अच्छा, how would we interpret the skin pinch for assessment of dehydration? We release the skin hold after 1 second and see if the skin pinch goes back. But there are three possibilities. Remember the color coded chart. ठीक है, रेड, पिंक, येलो, ग्रीन. दिस इज ग्रीन, ब्लू आ रहा है बट दिस इज ग्रीन. कि अगर इमीडिएटली वापस चला जाता है स्किन के पिंच, दैट मीन्स रिटर्न्स नॉर्मल है. इफ इट्स गोइंग स्लोली और वेरी स्लोली तो देयर इज डिहाइड्रेशन. अगर स्लोली है तो लेस देन 2 सेकेंड्स में जाएगा, वेरी स्लोली है तो मोर देन 2 सेकेंड्स. अब ये देखो, दिस बच्चे के पिंच किया है, दिस वाज सो स्लो दैट द एग्जामिनर वाज एबल टू इवन टेक द पिक्चर. ठीक है, तो डेफिनेटली इट्स मोर देन 2 सेकेंड्स. इमीडिएटली में तो फिर हमें कुछ पता ही नहीं चलेगा, वी कैन नॉट टेक द पिक्चर. दिस इज हाउ वी चेक द स्किन पिंच. देन we'll classify dehydration. अभी हमने जो again the same color coded chart, अभी हमने जो सारी चीजें देखी थी, any of the two of them. अच्छा, two of them कौन सी जो हमने चेक किया था ना, जनरल कंडीशन में lethargic और अनकॉन्शियसनेस है, sunken eyes है, not able to drink or breast or drinking poorly है, और skin pinch goes back very slowly. These are all the severest form of the 4 condition that we checked. ठीक है, तो not necessarily all 4 of them are required, only 2 of them is required. Okay, if present, we'll classify as severe dehydration. And as we discussed previously, severe classification needs immediate management and referral. अच्छा, ये डायरिया की जो severe classification है, this is an exception. This can be treated अगर और कोई severe classification नहीं है, ठीक है, बाकी सारे symptoms की. तो this is the classification that can be dealt at basic health unit, and if that basic health unit is has the expertise of giving the IV fluids. So treatment हम एक ओवरव्यू कर लेते हैं. देयर इज अ पॉसिबिलिटी कि आपको नहीं समझ में आए बिकॉज दिस इज वेरी इनिशियल स्टेजेस ऑफ योर क्लिनिकल्स. सो डोंट पैनिक. मेन आपको क्या करना है, जनरल इंटेस्टाइन्स एंड क्लासिफिकेशन करनी आनी चाहिए. ट्रीटमेंट आ जाएगी बाद में. सो give fluid for severe dehydration. We have plan C for severe dehydration, and this is your homework. Okay, you people will read about different plans of dehydration. देखो 3 plans दिख रहे हैं हमें ना. Plan A for no dehydration, Plan B for some dehydration, and Plan C for severe dehydration. तो अगर कोई other severe classification नहीं है तो we'll give fluid for severe dehydration. That is the Plan C. And now this is your home assignment to do. Give appropriate doses of zinc suspension for 10 days. Yeah, if any other severe classification hai, to what would we do? We'll refer urgently to the hospital with mother giving frequent sips of ORS, advise mother to continue breastfeeding. और अगर कॉलरा आपके एरिया में प्रिवेलेंट है तो you'll give कॉलरल एंटीबायोटिक. देन सीवियर से नेक्स्ट में आते हैं सम डिहाइड्रेशन में. अगेन वही जनरल कंडीशन हमने देखी बट उसमें लेथर्जिक था, इसमें इरिटेबल और रेस्टलेस है. sunken eyes, drinking poorly था ऊपर, यहाँ पे not drinking eagerly है. ऊपर very slow था, नीचे slowly है, like less than 2 seconds but not immediately. So again any of 2 if present will classify as some dehydration. And remember, no, 2 signs must be there to classify. ठीक है, और अगर एक साइन है तो आप उसको स्टेप डाउन करके नीचे वाले को फॉलो करोगे. लाइक इफ द चाइल्ड हैज sunken eyes, ड्रिंकिंग पुअरली, सिर्फ एक यही साइन आ रहा है ना हमारे पास, ड्रिंकिंग पुअरली, एंड रेस्टलेस एंड इरिटेबल है. ऑल्दो practically not possible, but let's discuss it for the theoretical purpose. तो रेस्टलेस है बट इफ द चाइल्ड इज ड्रिंकिंग पुअरली तो यकीनन वो ड्रिंकिंग ईगरली की स्टेज से गुजर के ही गया होगा. ठीक है, तो ड्रिंकिंग ईगरली उसमें पहले रहा होगा. सो वी नीड एटलीस्ट टू क्लासिफाई द सीवियरेस्ट क्लासिफिकेशन. वन है तो विल स्टेप डाउन और नीचे वाला फॉलो करेंगे. दिस इज फॉर पर्पस. क्लिनिकल जजमेंट इज डिफरेंट. But yes, for your theory, for exams, two signs are required to classify. Yes, any two of the four signs. Not all four are required to classify. At least two. दो भी हो सकती हैं, तीन भी हो सकती हैं, चार भी हो सकती हैं. ठीक है. Now any of the two, some dehydration, तो उसमें आप fluid and food for some dehydration देंगे. That is plan B. Plan B आप खुद पढ़ोगे. You will give appropriate dose of zinc suspension for 10 days. Zinc help in epithelial regeneration and helps limit the diarrhea. अगर कोई और सीवियर क्लासिफिकेशन है तो अगेन रेफर अर्जेंटली टू द हॉस्पिटल. और अगर नहीं है तो एडवाइस मदर व्हेन टू रिटर्न इमीडिएटली. अभी हम ये जल्दी से क्विकली कर लेते हैं कि व्हेन टू रिटर्न इमीडिएटली क्या है. फॉलो अप इन 2 days if not improving. And not enough signs to classify as some dehydration or severe dehydration. Not enough signs to classify some dehydration or severe dehydration. मतलब कि जरूरी नहीं है. नॉट एवरी डायरियल डिजीज में डिहाइड्रेशन नहीं होती. कभी कभी सिर्फ डायरिया होता है. तो आप क्या लेबल करोगे इसको? एज नो डिहाइड्रेशन. फ्लूइड एंड फूड to treat diarrhea at home. That is plan A. Again, that is your homework. Appropriate zinc देंगे. Advise the mother when to return immediately करेंगे. Follow up in 2 days if not improving. चलिए, ये बस हाईलाइट किया हुआ है. Nothing to do in this. Next is classify persistent diarrhea. Remember, we asked a question for how long does the child is having diarrhea. So if the answer is 14 days, तो हम कहेंगे persistent diarrhea है. Now again we have to classify is twice. Okay, persistent diarrhea dehydration present with 14 days to severe persistent diarrhea. अच्छा, with any sort of dehydration, some भी हो सकती है, severe भी हो सकती है. And if the diarrhea is for 14 days but there is no dehydration, तो we say it's persistent diarrhea. Severe persistent diarrhea में क्या करेंगे? If dehydration is there, we'll treat it before refer unless the child has any other clinical classification, or refer urgently to the hospital. और अगर diarrhea 14 दिन से है but there are no signs of dehydration, तो we'll classify as persistent diarrhea. Advise the mother on feeding a child who has persistent diarrhea. Appropriate doses of zinc देंगे. Give multivitamins, mineral supplements for 2 weeks. Advise the mother when to return immediately and follow up in 5 days. थोड़ा जल्दी जल्दी कर रही हूँ क्योंकि we have almost passed the time. Then remember we ask another question, is there blood in stool? तो if the blood in stool is there, we'll classify it as dysentery. ठीक है. we'll treat. and how will we treat? This is yellow classification. मतलब आप ट्रीटमेंट दे के घर भेज सकते हैं, फॉलो अप पे बुला सकते हैं. No need to refer. Treat for 3 days with an oral antibiotic recommended for Shigella. And it is usually ciprofloxacin according to new classification. Appropriate dose of zinc देंगे. Advise the mother when to return immediately करेंगे. And follow up advice in 2 days. ठीक है. तो डायरिया की 3 क्लासिफिकेशन होती है. पहले आप डिहाइड्रेशन क्लासिफाई करते हैं इनटू सीवियर डिहाइड्रेशन, सम डिहाइड्रेशन एंड नो डिहाइड्रेशन. एंड इफ द डायरिया इज देयर फॉर 14 days और मोर, देन यू से इट परसिस्टेंट डायरिया. फिर आप परसिस्टेंट डायरिया को क्लासिफाई करते हो इनटू simple persistent diarrhea and severe persistent diarrhea. And if there is blood in stool, there would be another classification that is of dysentery. अच्छा, देन क्विकली फिर आप क्या करते हो? उसका इम्यूनाइजेशन चेक कर लेते हो. इम्यूनाइजेशन स्टेटस. आई होप यू ऑल नो कि डिफरेंट इम्यूनाइजेशन स्केड्यूल क्या है. बर्थ पे रखते हैं. बर्थ पे बीसीजी लगता है. 6 weeks पे पेंटावेलेंट OPV1 लगता है. अब हम न्यूमोकोकल भी लगाने लगे हैं ना, और रोटा वायरस भी लगाने लगे हैं. तो दिस इज द ओल्ड चार्ट. then 10 weeks, then 14 weeks, then 9 months, then 15 months. ठीक है. Immunization at every visit. If the child's immunization status should be checked, and if the child has missed, so we'll advise immunization. ठीक है. Then vitamin A supplementation status. If the child is 6 months or older and has not received the dose in last 6 months, so we give a dose of vitamin A in the clinic. ठीक है. हर 6 महीने पे देना होता है. Then deworming status. हमारे यहाँ पाकिस्तान में iron deficiency is very common. ठीक है. So either the cause of it, in most of the cases, there is the cause of the iron deficiency is worms. सो क्यों क्यों है ये? इसलिए बिकॉज ऑफ बैड हाइजीन कंडीशन, पुअर सैनिटरी कंडीशन, हमारा जो पानी आता है वो भी खराब आता है। एंड रही सही कसर, बच्चे जो जो जंक ईट करते हैं, दैट ऑल दे ऑल precipitate the worms in the child. Worms in the child is very common. The child coming to you is 1 year older, 1 year or older, and has not received deworming dose in the last 6 months. तो आप उसको क्या करते हो? मेबेंडाजोल दे देते हो 500 mg की सिंगल डोज। ऑल चिल्ड्रन में आपको ये करना होता है। अच्छा, ये हम स्किप कर रहे हैं, इम्यूनाइजेशन की आपकी नेक्स्ट क्लास होगी। आई थिंक वी हैव कवर्ड ऑल दिस। अच्छा, कॉन्ट्राइंडिकेशंस टू इम्यूनाइजेशन विल बी कवर्ड। अच्छा, ये हमने कर लिया है कि मैनी चिल्ड्रन एज 12 months और ओल्ड इन पाकिस्तान दे हैव एनीमिया that is caused or made worse by hookworm infestation. So mebendazole is considered safe and it's advisable after every 6 months. Achha, I'm looking for a chart that is treat the child। अच्छा, treat the child में आपने क्लासिफाई तो कर लिया, तो उसके बाद आप ट्रीटमेंट क्या करेंगे? गिव अप्रोप्रिएट ओरल एंटीबायोटिक्स देंगे। टीच द मदर टू गिव ओरल ड्रग्स एट होम देंगे, कैसे देनी है। टीच द मदर टू ट्रीट लोकल इन्फेक्शंस एट होम, वो कभी कभी ईयर इन्फेक्शंस होते हैं तो उसको क्लियर करके विकिंग ऑफ द ईयर करनी है। निस्टैट ओरल थ्रश है तो निस्टैटिन कैसे अप्लाई करनी है, यू टीच द मदर हाउ टू डू ऑल दिस थिंग। ठीक है, डायरिया है तो ओआरएस कैसे देना है, कितना देना है। give extra fluid for diarrhea and continue feeding। तो डायरिया का whatever plan you have followed, you will counsel the mother कि सिर्फ वो ही नहीं देना, extra fluid भी देना है। Extra fluid is that, how do you counsel the mother for extra fluid? You say कि you have to continue feeding the child। There is a misconception कि whenever there is diarrhea, just stop giving anything to the baby। ठीक है, because that will, they fear that it will exaggerate the diarrhea, but that does not exaggerate। अगर एक बच्चा वैसे ही एनर्जी लूज कर रहा है in diarrheal fluid and vomiting and you are stopping the child from eating or drinking anything, so it will only add to the illness of the baby। So stopping the feed is not advised in diarrheal illnesses। ठीक है, rather the baby needs extra fluid, more water based fluid is required। इसमें आप क्या कह रहे होते हो? करीज, you say to give them yogurt, you ask them to give increase amount of ORSs, increase amount of clear fluids। So this is how we counsel the mother। We are skipping it। अच्छा जी, हमने कर लिया है कि fluid in food, increase fluid and continue feeding during the illness। Advise a mother when to return to the healthcare worker immediately and follow up। ठीक है, when to return immediately में आप मदर को क्या बताओगे कि for any sick child, if the baby is not, अगर appearance of any general danger sign। ठीक है, जब आपने असेस किया उस वक्त जनरल डेंजर साइन नहीं थे, बट एंड यू गिव द ट्रीटमेंट टू द बेबी, टेल द फॉलो अप कि डायरिया पे आपको 3 दिन पे दिखाना है वापस, बट यू ऑल्सो टेल द मदर कि व्हेन शी सपोज टू रिटर्न इमीडिएटली, वो कब है। तो नंबर 1 इज अपेयरेंस ऑफ द जनरल डेंजर साइंस। आप माँ को बताओगे कि अगर एट एनी स्टेज द बेबी इज नॉट एबल टू ड्रिंक और ब्रेस्ट फीड है, बिकम सिकर, ठीक है, डेवलप्स, अच्छा फीवर, इज नॉट टू रिटर्न इमीडिएटली, बट दिस कैन बी कंसिडर्ड फॉर स्मॉलर न्यूबॉर्न्स, क्योंकि न्यूबॉर्न में फीवर इज वन ऑफ द साइन। तो फॉर 2 months अप टू 5 years में नहीं है, बट छोटे बच्चों में, स्मॉलर इन्फेंट्स में कैन बी कंसिडर्ड। और अगर डायरिया के साथ, अभी हम डायरिया का कर रहे हैं कि अगर ड्रिंकिंग पुअरली हो रहा है बेबी, लाइक मीन्स चाइल्ड इज गेटिंग सिकर, और पहले ब्लड नहीं था बट अब ब्लड इन स्टूल हो गया है, तो दिस इज द कंडीशन इन एट विच द मदर नीड्स टू refer immediately। So with this we come to the end of session। We don't have time for question answer session। एक आध क्वेश्चन जब तक हैं तो हम देख लेते हैं। a given 20 ml per kg ORS nahi hai beta, this is wrong. Role of the zinc, it helps in the regeneration of epithelium. Galaxose D, it is the normal glucose, they are not recommended in cases of diarrhea, but there are certain other conditions जिसमें ये दे सकते हैं. Or 14 days. Thank you. So with this, I hope the things are clear. So that's all for today. So shall we stop now? Then, chalo, okay. Thank you so very much. I am leaving the meeting.
Yes, ma'am. Assalamu alaikum.
वालेकुम सलाम. जी जी एंड कर दीजिए. ठीक है. ओके.